Alright, what's going on, guys? This is Parabolin here, and today I want to talk to you guys about canthoplasty. This is going to be a very fun video for me because oculoplastics is my biggest, interest, right? The eye area, understanding what makes an aesthetic eye area is kind of my specialty here. So let's dive right into it. So what is a canthoplasty? Canthoplasty is just a surgical procedure that's going to reshape and reposition the lateral canthus, which is the outer corner of the eye. Right, you can do it to change eye shape, fix sagging eyelids, or create that sharper lifted canthal tilt or angle. It's essentially like canthopexy on roids, because pexy means tighten, but plasty means cut, build, reshape. So, canthopexy is just going to tighten the lateral canthus, but canthoplasty is going to reshape the whole area. And I highly recommend, individuals, obviously I'm not a doctor, but I recommend individuals to pursue or, learn more about canthoplasty as opposed to canthopexy, because I think it's a far more effective procedure. Why do people get canthoplasty, right? I got canthoplasty. Why? Well, canthoplasty can help to fix droopy and sagging outer eyelids, and usually you want to combine canthoplasty with lower lid retraction, right? Lower lid retraction is going to directly tighten the lower eyelids. When you perform a lateral canthoplasty on a patient, you're essentially stretching the lateral canthus up with the goal of creating a PCT of around maybe 2 degrees, right, in the patient. The problem is that when you do this, a lot of patients that have NCT, they also have droopy and sagging out, lower eyelids. So it's essentially going to just stretch that area without tightening it, which can create an, not an optimal result, right? So we want to combine those two surgeries. It can also create a sharper almond eye shape, stabilize the eyelid, and raise or tilt the lateral canthus, which is the most important goal with canthoplasty. So, patients are typically looking for a slight upward tilt. Like I said, 1 to 2 degrees of positive tilt. They're looking for tighter lower lids and less scleral show. And again, lowering scleral show is also something that lower eyelid retraction can help with. So let's dive in now to how does canthoplasty actually work. So as you guys can see here, if we look at this diagram, right, with the three incisions here, the first incision is going to be at the outer corner of the lateral canthus. Okay, the surgeon is going to open the lateral canthus, which is usually hidden in the natural crease. Especially for me, because my brow ridge causes hooding, so my crease is hidden under there. The second step is that the doctor is going to cut and release the lateral canthal tendon. This is the part that a lot of people misunderstand. With canthoplasty, the surgeon cuts the tendon, right, with freeing the eyelid so it can be rebuilt at a better position. The third step is that they're going to reattach the tendon higher or tighter. They usually secure it to the lateral orbital rim, and they do this by lifting the corner, changing the tilt, tightening the lid, and ultimately reducing scleral show, right? The fourth step is that they're going to shape and refine the outer corner. A lot of it just depends on the surgeon's style. Some, are going to sharpen the angle more than others, right? The last step is that, they're going to close the incision. So that's essentially the 5 steps on how a lateral canthoplasty is performed in a medical context. As you guys can see, it's not super complicated, like surgeries like, bimaxillary surgery or things like that. There's a few different techniques. Like I said, lateral cantho is standard. There's also canthopexy. There are other things like that, but these are very ineffective procedures in my opinion. So let's talk about who would be an ideal candidate for this surgery. The first thing I'm going to say is anybody with negative canthal tilt, people with naturally sagging outer lids, people with scleral show, right? these are all types of individuals that are qualified candidates for canthoplasty. Let's look at this picture here. This is a patient from Dr. Mariar Tiban in LA. This is a very, very interesting case because, you know, I think that this is one of the best candidates for cantho. So let's understand, you know, what the structural phalos are, and, you know, let's look at the difference. So as you guys can see, you know, the patient is presenting negative canthal tilt. It's not severe in this situation. I mean, it looks like maybe -1 degrees or maybe -2 at most. But the biggest issue here is that the patient has a lot of scleral show, you know, below the iris. So this patient, you know, based on the website, is actually 27 years old, underwent eye transformation, including lower eyelid retraction surgery with canthoplasty, infraorbital rim implants, and orbital decompression, and upper eyelid filler. So this is not just the canthoplasty, and that's why, as I talked about before, there are not a lot of cases where, you know, somebody is going to perform a standalone canthoplasty, right? Because usually the goals of a canthoplasty are to improve eye area aesthetics, and it usually takes, you know, a few procedures to do so. If you don't place an infraorbital rim implant, you know, in the under eye area, you're gonna have a hard time, you know, pushing up the lower eyelids without having actual, you know, bone under the eyes. So if you don't have under eye support, it's very hard to achieve this result with just a lateral canthoplasty. So in my opinion, to achieve the best result like this case study, I think the patient would want to pursue a combination of oculoplastic surgeries such as cantho plus lower lid retraction plus infras, right? I already talked about infraorbital rim implants and how they're supportive surgery, but I think that when it comes to generating these outcomes, I think it takes a bit of planning, and I think that canthoplasty is a tool. But again, it's not a standalone surgery, same as infraorbital rim implants. All right, so finally, let's talk about recovery. I'm going through it right now, so I can speak from experience, but you know, typically swelling and bruising is going to take like 1 to 2 weeks. Shape, you know, the shape is going to settle around 4 to 8 weeks. The final result is going to, you know, take 3 to 6 months, and, you know, you typically will start to, right after the surgery, I mean, you'll see, like, right after the surgery, your canthal tilt will look different. Your eye area is going to look very different, but, you know, essentially the swelling and localized edema are going to prevent the, you know, actual visual, you know, results in the tissue from being, you know, accurately seen. So this takes time, guys. Like, this is not like filler, okay? It's not like you walk into a filler clinic and, you know, some 22-year-old girl with almost zero medical knowledge is just going to inject some, you know, silicone and you're done. Like, it's not like that. This is a real medical surgery, okay? And that's why it's way more effective than some bullshit like fillers. But anyways, guys, that's it for today's video. I hope this is helpful, and I'll see you guys next time.